Hi everyone, thank you, Jose, first thank you for inviting me to talk here today. It's a great pleasure to participate in this event, and I'm really looking forward for the Congress in Valencia next year. I'm sure that everyone that decide to go to Valencia will be very happy. I love that city, I love the people there, and I'm pretty sure that the organizers will do the best to provide us a great experience. Um, well, I have to say that most of the things that I learned from infrared thermography, I learned from Jose. Then we can share we could actually share the session here because we'll soon understand why we have been working together for a couple of years now, and I think almost 15 years of collaboration. There's a very strong collaboration between our university here in Brazil and the University of Valencia in Spain, and much more than the many papers that we have generated together over the years. We have a strong connection of people. Right now, there's a lot of Brazilians working in Valencia. Last year or so, we had students from Valencia coming here as well. And all of this started a couple of years ago when Jose came to Brazil to spend a couple of months. I hope you can see my the arrow of my mouse in the screen. And Jose came to Brazil to spend a couple of weeks in our lab with support of the International Society of Biomechanics that covered part of the costs with a travel grant. And the reason that I mentioned this is because Jose showed you in the beginning of this session that there are options for travel grants to the Congress next year as well. So especially the students here in the session and also fellows professors here, make sure that the students learn about this and how to apply for the grant, because that's a great opportunity not only to attend the Congress but to create a long-term collaboration. So just this is just a celebration slide to thank the group from Valencia for all the collaborations we had in the past. Of course, I mentioned Jose here, but there are so many other people from Valencia that we work together. Okay, so for these 20 minutes here, I try to select three topics, let's say. First one would be very quickly, it's why exercise can cause damage and delay onset muscle soreness. And the second one, it's about the discussions of a connection between uh, skin temperature and exercise induced muscle damage, and what is the background behind that. And finally, I will quickly cover some of the studies that we have developed over the past years with some question, much more questions than answers, sorry, from these studies. But hopefully, together we can discuss and the area can move on uh, to, 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 to have a better use of infrared thermography in sports science, because it's a very powerful tool. So I think that most of people here in the online room at some point have experienced some muscle soreness following exercise. Doesn't have to be a very intense exercise. Sometimes you just go to the gym and then you change the exercise that you do, like you are doing some specific exercise for your quads, and then you change the exercise type of the range of motion, of speed of movement, and then 2 days later you are very sore. Like, wow, when you wake up in the morning you can just feel your joint stiff, your muscle is stiff, and that discomfort is what we call the delay onset muscle soreness. If you go to the literature in general, when you have a condition of DOMS, then you can have, I will not say that you always have, because that's not the case actually, but you can experience some strength losses. So you will not be very weak because of the muscle soreness, but you can lose a little bit of strength. You can have difficulty to perform the full range of motion for the joints. You feel swelling, higher sensitivity to touch, which is associated with pain, right? And we try to relate this pain, with the damage to the muscle. And here in the right of the panel, you see the very classic image of a control muscle, where you have like the sarcomeres very well organized, the band, the Z bands, everything is quite well. And after eccentric exercise, then you see a lot of disordinated sarcomeres, and in general, it's one way to show that the muscle suffered damage. This is not biomechanics. Actually, there's a lot of physiology, biochemistry behind. There's a lot of events happening that result in the pain. And one of the major conditions that are associated with the DOMS and the symptoms is inflammation. Yeah. And we have the general idea that inflammation increase temperature in the region and change the vasodilation and everything, and that production of heat could change the skin temperature, because it would be much easier to measure the skin temperature than to measure like the muscle temperature. I'm not going to discuss in deep the physiology behind, because that's not my major expertise. But there's some difference when you have inflammations like in the deep tissue, and the temperature that will be transferred to the surface of the skin. Yeah. So beside that, we have some background that show us some possible relations between muscle damage and changes in skin temperature, right? Studies from decades ago provide some context, some directions of the thinking that we developed over the years. But in general, these studies, they are very important. They are very relevant, right, for the field. But they have some general conclusions and some limitations as well in the way the measurements were conducted. And and this is also because the technology has evolved so quickly in the past years, rather than like 15, 60 years ago. And to the date, we have a couple of studies published in the literature. And of course, we understand that infrared thermography is easy to use. It's relatively cheap. Yeah. Of course, the camera can be expensive, but once you have the camera, uh, you don't need many supplies for performing the measurement. So this is why I classify here as relatively cheap and relatively easy, because I'm just considering here like not video or not more complex measurements that Barlow just showed us, but just the thermal images. It's like taking pictures, right? So it's not difficult to implement. So it sounds perfect for monitoring physical exercise, but an exercise produces heat, so it's all about changing temperature. But what, in my perspective, we need to take care is because we have a lot of study with some limitations, and not limitations.
Coming.
Okay, no problem. And not limitations in the study, but in in the conclusions. Yeah. For example, that's very difficult to find out one study showing higher correlations between changes in physiological outcomes that can be a marker of muscle damage and changes in skin temperature, for example. So we have like weak correlations, we have sample limitations, we have difficulty in conducting field studies because work in the exercise science sometimes is challenging. And altogether, it end up that we propose some theories, the literature proposed some theories to the investigation between muscle damage and changes in skin temperature. But we have the both sides of the coin here, because we have studies suggesting these relationships, and we have studies showing that the relationship is not that clear, that direct as we expected before. Here we have one study from Valencia group and also from collaboration with Germany, showing that muscle damage, it doesn't alter skin blood flow 24 hours after damage induction in the quads, if I'm not wrong here, and without change in skin temperature. So so we take this conclusion here. It's interesting because this is the base for everything that we have been discussing, at least in our groups, between the relationship of exercise, damage induction, and changes in skin temperature. Because we need the blood flow to change the temperature of the skin. Yeah, and here we have measurements over different days and consecutive days in physical active participants. So that said, there is a background for the investigation of the relationship between muscle damage and infrared temperature. What are the problems in my perception until so far? The experimental designs, the human factors, the cofactors that influence the relationship between exercise, damage, and skin temperature, and some conclusions grounded in studies with not very strong statistical outcomes, especially regarding the correlations. So when we start doing collaboration between our group and Valencia, I remember that I was discussing with Jose that I would be much more interested in understanding the limitations of the technique than showing the potentials, because there will be a lot of people working to show the potential of using the technique to monitor exercise size, but we need also to question the relationship. Like, we have to fight against a hypothesis, right, and to make the theory stronger. So in this final part of my talk, I will mention what we have observed when we investigated this topic in the past few years. So this is the very first study that we published together from our group from Brazil and Valencia. I'm really proud of this study because it got a lot of attention in the field, a lot of citations, and from time to time people comment on that. And in here, we observed that the physical fitness, and please pay attention that this paper was published like 11 years ago. So a lot of new knowledge is available today. And also the way that we analyze the data may have changed a little bit over the last 11 years. But in general, we found that physical fitness could be considered a factor of influence on the response of skin temperature during maximal cycling exercise. And it's interesting because we know that in general, the athletes with a better thermoregulatory capacity, they also will have better performance. Yeah, but of course, skin temperature is not directly related to the body thermoregulation, but it is one indicator, right? So one initial conclusion then is that the physical fitness could be a factor of influence, and therefore if we evaluate athletes and non-athletes, or even people with some clinical conditions compared to control, they are expected to have a really difference, right? So, and then we moved our focus to the muscle damage. We had a lot of previous projects and theses, including like theses developed both in Brazil and Valencia, investigating this question. And in this paper here, we we conducted the basic protocol for muscle damage. It is like eccentric exercise, and then you follow the participants the next days. And after we measured the skin temperature 24 hours after exercise, we found that maybe 24 hours can be too late to see the change due to exercise, because the way that temperature changes over exercise and recovery might not be, how can I say that? Barlow just shows us that we need more information, and that the time window of change might not be the same that we have for other physiological outcomes. We also observed that we design the exercise differently, like with combinations of different number of repetitions, or repetitions until exhaustion or not. would not be a major factor of changing the response of temperature. So exercise is something that can change the skin temperature, but the small change in the configuration of the exercise might not be a major factor of influence, right? We also, in part of these investigations, monitor blood responses with the basic creatine kinases CK measurements. I have my personal concerns with this measurement, but whatever, it's very common everywhere. Like in Brazil, in soccer, they use all the time. But we found that maybe, and this is not just us, of course, I mentioned the studies that we developed in our lab, but you see many other papers in the literature with similar outcomes here. And we found that the CK and the skin temperature response might be not time aligned. So, and the way that the blood marker changed, the speed or the velocity of change, or the time that participant need to show difference in the blood markers might not be time aligned to the changes in skin temperature. And that's a problem because sometimes what we just want is to try to use the skin temperature outcome to replace some blood marker that we need more time. It's not that cheap as thermography to measure. But again, we are not against the topic, but we are not believers as well. So one question that came for us is like, which outcome to observe, right? Because the post-exercise, it's very complex measurement because we have the sweat, we have anything that the hydration, anything can influence the outcome. So we moved the shift a little bit to the basal temperature before exercise. And we found that without some strict control of the exercise characteristics and also the days before and after exercise of the routine, the daily routine before and after exercise, basal temperature is also difficult to provide relevant information. But when we control for these cofactors, like following participants before and after exercise, not controlling in terms of defining exactly what they are doing, but making sure that all participants are having similar routine during a training camp. That was the case of this study here. Then we found some interesting outcomes from the basal temperature that at that moment, in our perspective, would be a nice option because the basal temperature will be measured before exercise and would reflect the adaptations for the previous days of exercise. So a midterm conclusion here is that any measurement of skin temperature may require strictly control of the routine of the participant regarding exercise and recover. And of course, when you have repeated measurements, the outcomes, how can I say that it will be more, the outcomes will be clearer when you have more than one measurement. And this is why my perception, we have in the literature very nice studies that have so many measurements of one participant, and then they are able to find relevant conclusion and also strong statistical support. Finally, these are the three last slides of my talk. We have been also investigating some factors that worry us when we have a participant coming to the lab. For example, we always follow the checklist published in the literature. Many of the authors of the checklist are here in the room, but we never know, right, if the participant actually follow our recommendation about hydration, eating, sleeping, whatever. Yeah. So here we try to confuse the human physiology. So we combine low intensity exercise with the measurements of skin temperature to simulate like when the participant come to the lab walking or I don't know, standing for a couple of minutes before waiting for the measurements. And we found that when we have this low intensity exercise, before the skin temperature measurements, we don't have any effect in the outcome. And I'm showing this study here not to discuss the effect of the DOMS and the temperature, because that effect's not that clear as I would expect it, but adding some low intensity exercise before a measurement following conditions of DOMS will not change the outcomes of the temperature. More recently, we also performed some experiments comparing like men and women and trying to relate the skin temperature outcomes with the pain thresholds, for example. And we found that there are some subject dependent factors that still unclear. Yeah, so there are some difference between men and women that we should be aware of, and also the way that we quantify soreness using like the visual scales or the pain threshold using the mechanical stimuli. And finally, one of my observations here is very aligned with the talk that we just heard from Barlow, that we have these local and global responses, which for my perspective, it's a window of opportunity for future studies, because sometimes when you have a very small muscle, we have very clear results that align with all the theory behind the hypothesis of connecting of the relationship between damage and changes in skin temperature. But when you have like a larger muscle, sometimes that relations are not that clear, but maybe we have something still open here, that my perspective is what Barlow just showed us, the way that we analyze and the variables that we consider when doing these investigations. So trying to finish up on time, some conclusions. I really like this paper here. I think that many of you have seen this paper before. And the more important thing that I like to highlight here is that we have a lot of studies on infrared thermography and exercise and injury, muscle damage. That's not the case here of this paper, muscle damage. But when the authors searched papers to run a meta-analysis, for example, just 6 studies were included. So I have, in my mind here, we have a very clear perspective that we need to improve the quality of the studies that are being developed, and we need to do research to find the way to have more standardized parameters to consider that will allow us to compare the studies. Yeah, we have to be more strict related the outcomes, not only visual analysis, because the author reported many papers they just discuss like based on visual analysis of the images, right? And of course, we have to be aware that in some conditions we might not need the skin temperature measurements to take a conclusion, like we don't have a fracture or a muscle rupture or something like that. Yeah, so that's not the main application. I think the main application will be to monitor the physiological responses following exercise. That the window of opportunity that I see as more relevant and important. Let me see if I have a message. Oh no, I thought Jose would tell me to finish already. Okay, so open for questions. Thanks for your invitation. I would like to invite you for the ISB Congress next year in Sydney, Australia. It'll be in July, so you can stop by Valencia in June, and then July go to Sydney for the conference in biomechanics. There'll not be a lot of infrared thermography there, but there will be good science as well. Jose, thank you, and I give it back to you.